Ranexa tablets is used to treat a certain type of chest pain, chronic stable angina. It decreases the number of times you may get chest pain. Relieving symptoms of angina can increase your ability to exercise and perform strenuous work. Ranolazine works differently than other drugs for angina, so it can be used with your other angina medications, including nitrates, calcium channel blockers such as amlodipine, beta blockers such as metoprolol. It is thought to work by improving how well the heart uses oxygen, so that it can do more work with less oxygen. How to use. Initiate Ranexa dosing at 500 mg twice daily and increase to 1000 mg twice daily as needed based on clinical symptoms. Take Ranexa with or without meals. Swallow Ranexa tablets whole, do not crush, break or chew. The maximum recommended daily dose of Ranexa is 1000 mg twice daily. If a dose of Ranexa is missed, take the prescribed dose at the next scheduled time. Do not double the next dose. Contraindications. Hypersensitivity to the active substance or tonia of the excipients, severe renal impairment, moderate or severe hepatic impairment, concomitant administration with intraconazole, ketoconazole, voriconazole, posaconazole, HIV protease inhibitors, clarithromycin, telifromycin, nifazodone. Warnings. Ranexa may impair your thinking or reactions. Be careful if you drive or do anything that requires you to be alert. Grapefruit and grapefruit juice may interact with Ranexa and lead to unwanted side effects. Discuss the use of grapefruit products with a doctor. Take Ranexa exactly as prescribed by a doctor. Follow directions on the prescription label. Your doctor may occasionally change your dose to make sure you get the best results. Do not use this medicine in large or small amounts or for longer than recommended. Ranexa may be taken with or without food. Ranexa side effects. Get emergency medical help if you have any signs of an allergic reaction to Ranexa, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Call a doctor at once if you have a lightheaded feeling, like you may pass out. Headache with chest pain and severe dizziness, fast or pounding heartbeats. Kidney problems, little or no urination, painful or difficult urination, swelling in your feet or ankles, feeling tight or short of breath. Common Ranexa side effects may include nausea, constipation, headache or dizziness.